Hi, my name is Tyler Bowman with Tulip Hill Recovery. I'm business development and I've been working at Tulip Hill for over a year now. One of the core things that we kind of focus on is the mental health and the substance abuse as a whole. We firmly believe the mental health is driving the substance abuse, which is a symptom. We do a 90-day continuum, partial hospitalization and intensive outpatient. So over the 90 days we go through 3 phases. The first phase is partial hospitalization, which is like a true inpatient. They're doing 8 hours a day, 6 days a week of clinical. We implement equine therapy, trauma-informed therapy, acupuncture, art therapy, as well as a lot of other modalities. We really want to figure out what the core issues are, and we kind of peel back the onion and start to work through it. At that point, the patients are very intensive. We're transporting them to and from the facility. They're under our care 24/7. We're always keeping eyes on them. Tulip Hill is a family. We really want to serve the community and show people that they can work through their experiences, and that's why we stay with them long term. So after they complete phase 1, they're going to step down into phase 2 for an additional 30 days. That's 5 days a week, 3 hours a day in the morning of intensive outpatient. They're coming in, continuing to do group therapy to process with their peers. Their med management's also included, so we're dealing with their medications and continuing to support them from that end. We really start to work on resume building and job search. I think that a lot of people in early recovery don't know what makes them happy. What is it that we do after we get sober? How do we have fun anymore? Those were some of the things that came up for me when I got clean. I thought that naturally I couldn't have fun. My perception of fun was skewed, so we want to empower these people. And so in phase 2, they're still not going to be working, but they're going to continue the job search phase. They're going to continue to stay along with us, and then we want them to get a job through Indeed. We don't go through a temp agency. It's a little bit different. And if they don't have a job by phase 3, which is the last 30 days, they have to volunteer at Greenhouse Ministries, or they're stepping into their job. Phase 3 is 3 days a week, 3 hours a day, so it's a lot less intensive. At this point, they have a lot more freedoms. I think the biggest thing about Tulip Hill is probably their culture. We don't have beachfront property as a treatment facility, but what we do is we invest in our people. We're a small treatment facility, 36 beds. We call it a mom and pop treatment facility. Ben Jones is the owner along with his wife Tess. Tess is the yoga instructor at the facility, and Ben is also a licensed clinical social worker. So we take the clinical side very serious. We have 6 master level clinicians, which are therapists. We have a psychiatric nurse practitioner, and we just brought on Dr. Amin from Trust Point as our psychiatrist. And we also have a doctor on staff. So a lot of stuff there for the mental health side. So we're able to support them through that whole process. I say if anybody wants to come to Tulip Hill, you just have to be willing. You have to be ready to surrender and get to the point like I did after my 5th overdose, when I decided that I tried it everybody else's way and my own, and I was willing to take some direction. Those are the ones we want, the people that are willing to grab onto recovery and start a new lifestyle. If you need to reach out, we do access private insurance. We have an affordable self-pay rate, and we'll work with families. If you need to get in touch with me, you can call me on my cell phone. My number is 615-715-8463. That's 615-715-8463. If you don't have insurance, you don't have resources, or you just don't know what to do, just call me and we'll help find you a place. It doesn't have to be at Tulip Hill.